if it was a eureka moment, because when I first started learning about MLPs, I was like, this is what I've always wanted, this makes sense. But I had one patient that before we kind of got up and running that I ran into, that I was like, oh, this is why we need it. And it was a patient that I had seen many, many times in the emergency department. My whole department knew her. And what she would do is she would come in incredibly ill. It was almost always the same complaint: difficulty breathing, a pneumonia, a COPD exacerbation. And then she would always leave against medical advice over and over again, to the point where the inpatient teams would be almost frustrated when you called, because they knew what was going to happen. And then this one day, I went because she wanted to leave against medical advice, went to go talk to her. And for the first time, she told me the reason she kept leaving was she was worried about her Section 8 voucher. And she was worried about losing her housing and the housing for her daughter. And that's why she left. And it made all the sense in the world to me that she would say, look, I'm well enough, I can go, I'm not going to lose my house. And I just knew then, if I had a lawyer that could talk to this patient, that could ease that concern, not even necessarily solve the case, but just ease that concern, maybe she'd stay in the hospital, maybe she'd actually get better.